Image source homegymr.com. Tendinitis, which is also known as tendinitis, is a disease which occurs due to the inflammation of the tendon. Most commonly, the injury takes place due to injury to the tendons while doing any activity, especially while playing sports. In this problem, along with inflammation, acute injury also takes place. Here, we have tried to provide you information about the problem of tendinitis or tendinitis along with its major causes as well as symptoms. Read on to know more about the types and treatment of the problem of tendinitis. What is tendinitis? As mentioned earlier, the inflammation of the tendons due to certain injury or trauma is known as tendinitis. Most commonly, it is associated with the injury to wrists, thigh, finger, elbow along with other parts of the body. A tendon is a part of the body which extends from muscle to bone. This tissue is flexible and can bear the tension. Although the tendon tissues are fibrous and tough, they are considered as soft tissue as they are very soft compared to bone. The disease is also known by a more common name, Achilles tendonitis, along with tennis or golfer's elbow, pitcher's shoulder and jumper's knee. Sometimes, instead of a tendon, the sheath around the tendon starts to become inflamed and the condition is known as tenosynovitis. In various cases, it has been found that tenosynovitis and tendinitis occur together. Even though the problem of tendinitis can occur in age group, it's more common in adults who are involved in a lot of sporting activities. In elder people, the elasticity of the tendon starts to lose and starts to become weaker. These people are also at the risk of causing the disease. The long-term, as well as degenerative version of tendinitis, is known as tendinosis, which possesses the similar symptoms. Symptoms and signs of tendinitis. It is important to note that the symptoms of tendinitis occur where the tendon is attached to the bone. Some of the major tendinitis symptoms and signs are listed below. Redness, heat as well as swelling, development of lump along with tendon, severe pain which increases on movement, feeling of crackling of tension or grating after the movement. Sometimes rupture can also occur in the area and the gap can be felt in line of the tendon. This will cause difficulty in the movement. Symptoms of tendinitis can stay up to a few days or several weeks or even months. What are tendinitis causes? According to the experts, common tendinitis causes include excessive repetition of the movement over time and sudden injury. Most commonly, sportsperson who are involved in excessive repetitive movements, which can cause the aggravation of the tendons, are at the greatest risk of this condition. Some of the other risk factors or causes of tendinitis are as follows. Profession: a person doing a job which involves repetitive action or requires to be in the awkward position such as painting a ceiling or playing various sports such as running, basketball, golf, bowling, baseball and swimming and tennis. Age: as mentioned earlier, elder people are at risk of suffering with the problem of tendinitis as the tendons become less flexible and lose its flexibility due to the injury. Various health conditions: certain health condition also plays a key role in causing the problem of tendinitis. These conditions include rheumatoid arthritis as well as diabetes. Medical attention is highly recommended if the pain starts to get worse and it suddenly becomes almost impossible to move the joint. Diagnosis of tendinitis: most of the times, your doctor will examine the symptoms after carrying out the physical examination of the tendons. Sometimes, you can hear a creaky sound after doctor moves the tendon, due to the inflammation as well as the thickening of the sheath of the tendon. Tenderness at any particular point of the tendon is the sign of the tendinitis. If the problem still persists even after carrying out the initial treatment, a doctor can prescribe some tests such as X-ray test for finding the calcium deposits on the tendon along with ultrasound as well as MRI for finding the swelling on the sheath of the tendon. How to cure tendinitis? Tendinitis treatment: the treatment of the tendinitis is aimed at reducing the inflammation and providing relief to the pain caused due to tendinitis. Most of the times, it has been found that following the treatment provided below can provide relief to the problem of tendinitis. The treatment includes hot and cold treatment, OTC, pain relievers, rest, splinting of the affected joints. Details of some of the major treatment for treating tendinitis are provided below. Surgery or shock wave therapy: if the development of calcium on the tendon has occurred, you can use the shock wave therapy, which will be helpful in eliminating all the calcium deposits. Conducting surgery can also be one of the ways to remove all the calcium deposition on the tendon. Also, red hot and cold treatment: applying an ice pack or warm towel can be helpful in alleviating the pain as well as swelling in the affected area. You can apply the hot compress or ice pack for 1,015 minutes at least 2 times every day. Ensure that you are not applying the ice directly on the skin and use it after wrapping in a towel. The same goes with the hot treatment. Applying hot towels as well as a topical ointment, which can heat the area, can also be applied. It is recommended to apply ice on the injury occurred within 48 hours. The warm compress can be recommended for injuries occurred after that. Pain relievers. Some of the pain relievers can also be helpful in treating the condition. These drugs include OTC drugs. Some of the drugs such as ibuprofen and anti-inflammatory drugs can be used and reduce the pain caused by tendinitis. Corticosteroid injections. Even though this can be a good option, continuous use of the injections may increase the risk of rupture. Exercise and stretching. Doing particular exercises such as stretching can be highly helpful in reducing the pain and inflammation by the tendinitis. Physical therapy. Sometimes, providing effective massage to the area can be helpful in improving the pace of the healing process of the problem caused by tendinitis. Disclaimer: the above tips and information are only for reference purpose. The articles are not written by qualified Medicare professionals. Even though you may find the tips and information easy and useful, we recommend you to consult a qualified Medicare professional before adopting these. It is necessary to analyze and find out your physical fitness in accepting these tips. Some tips may not suit you or you may be allergic to. Hence, consulting a Medicare professional is essential. Failing which, you will be having the sole responsibility for the consequences arising out of your negligence and reluctance. Note: we inform you that we are not owner of any of the products, images, or any other products displaying on our website. But all the articles are written by us and we own them. If you found any image or product that found under your copyrights, then please feel free to contact us. We will remove that image or product as soon as possible. All the images are collected from Google.
Thank you for watching. Don't forget to subscribe to receive new video.